Hi, and welcome back to Body Beautiful. I'm Janelle Marie. We are talking with plastic surgeon Dr. Joseph Mealy about various procedures. And right now, Dr. Mealy, we are going to talk about breast reduction, female breast reduction.
That sounds right.
I believe this is very popular as well because a lot of my women friends say it's very painful having too large of breasts.
It can be, and there's sort of two peaks. We'll see people right after puberty who develop very large breasts, and they've gone from being athletic to not being able to compete because their breasts hurt. And folks, as they get older, the breasts tend to get a little bigger. As we get bigger, sometimes our breasts get larger. And by reducing them, we can get rid of that neck pain and back pain and other irritations that can be caused by it.
Absolutely. And let's go to picture number one, before and after picture. What's happening here?
So this is a side view of someone who's had breast reduction. And you can see we always do a lift with the breast reduction. So not only is the breast size reduced, but the nipple, which is blacked out at the bottom, you can see it gets moved up to the front of the breast where we like it.
And are the scars bad on a lift? What's going on there?
So the scars for lift, like the inverted T lifts, or they call them anchor scars, are about the same as they are for the breast reductions. The main thing we're doing with breast reduction is two things, really. One is removing breast tissue, reducing the volume, but more importantly is tightening up the skin. Because as we tighten the skin, the breast swings less. It also helps with the neck pain and back pain.
Absolutely.
And it just feels better.
Definitely worth it for sure. And let's go to picture number two.
Sure. So this is someone, again, from the side. Hers was a little more ptotic, a little more saggy. So the incision comes off a little bit more to the side. And I'm always trying to keep that side incision as short as possible. Ideally, I'd like to keep it under the fold of the breast. If it starts getting back into the armpit, which sometimes we have to do if the skin is redundant towards the back, that scar always ends up a little bit wider, a little bit redder, a little harder to conceal.
And what about downtime?
So downtime for breast lifts and breast reduction is not too bad. It tends not to be a very painful operation. Most people, the first few days, it's sore. By the end of the week, they're feeling pretty good.
And like mommy makeovers, you can combine procedures with this?
Yes, and sometimes I will do it with a tummy tuck. And when we do it with the tummy tuck, the breast reduction doesn't bother them at all because the tummy's a bigger distraction.
Exactly. All right, picture number three.
So on the third picture, this is a front view. You can also see she had some asymmetry. So normally one breast is a little larger than the other, and that's something we're always trying to address. The incisions, again, run underneath the breast. They run from the bottom of the breast in the middle up to the nipple and around the nipple itself. That allows me to really tighten up that extra skin, remove the excess, and keep the breast from dropping, keep it from falling.
And how young a patient can you see for this? Because I know a lot of young women have this problem where the asymmetry is off. So how young can...
Sure, we kind of want the breast to be done developing.
Right.
But I've seen people 14, 15 years old that have gone from flat to triple D and are very uncomfortable. In those cases, when we're going in earlier, there's a little higher risk of having to go back and do it again later in life.
Gotcha. And our final picture.
So the final picture, also a reduction in volume, but this is actually a breast implant removal.
Oh, really?
Sometimes, you know, maybe when we're 20, we're fairly flat, we get breast augmentation. As we get older, sometimes the breast will develop either with pregnancy or just normal changes with age. And then at this point, she was feeling like she was too big. So since she had an implant in there, I could just remove the implant. In this case, I have not done a lift or anything else. That's also a possibility if the breast is saggy or loose or empty.
Now, a lot of women are scared to have any kind of breast surgery or anything because they feel that if they get pregnant, maybe they can't breastfeed. What's the story?
Sure, no, that's always a concern, especially with breast reductions. The breast reduction, we do preserve the tissue behind the nipple. It's certainly recommended to try, but you'll likely make less milk.
All right, thank you so much. If we want more information on any of these procedures or you want to see the before and after pics, I'll give you the website in just a minute. You can call the office anytime at 925-943-6353 or go to sanfranciscobreast.com or drmealy.com. Those are where all the before and after pictures are. We'll be right back. We are going to talk about arm lifts in our final segment. Keep it right here on Body Beautiful.